Hi, my name is Dr. Jamie Adam, and I teach pharmacology. All the time I hear my students say, pharmacology is so tough. How am I ever going to remember every single thing about the drugs that we learn? So, I made this video for them, and I hope it helps you too to figure out exactly what you need to know about different drug topics. So, today we're going to talk about insulin. And hopefully, by the end of this, you know exactly what is most important for you to know when it comes to insulin. So, you'll be ready for your next test, you'll be ready for NCLEX questions, and you'll feel confident going forward. Okay, so insulin concepts. When you're thinking about insulin and, oh gosh, how do I remember everything that's important? I wanted to give you kind of a bulleted list of things that need to cue you. This one slide is pretty important and it's taken a lot of different information and put it all on one page. So we're going to spend a minute here, okay? So, with insulin, it's important that you know that not all insulin is equal. They all have a different onset, a different peak, and a different duration. So, when you're getting ready to administer insulin, you want to know which type you're giving and when that medication is going to peak. And you can refer back to that table to help you know. You should know that rapid acting and short acting insulins are sensitive to meal times. These are the insulins that they're going to start working just minutes after they're given. And so if that patient hasn't eaten anything, if they have an empty stomach and you give them insulin that works within 15 to 30 minutes, that's going to drop their blood sugar. So it's always possible that it could drop their blood sugar too low. So we think about meal times. If you have a patient whose breakfast is coming at 8 and you walk in at 7:30, you check their blood sugar and you see that their blood sugar is a little elevated and so you come back to give them their insulin, you need to know that that insulin is going to work very quickly. If you're giving a rapid acting or a short acting insulin, that insulin is going to work very quickly. So they need to make sure they eat. If they skip breakfast, maybe that tray is late to their room and they're late for their breakfast. They're going to see a drop in their blood sugar because of that insulin, and there's no food coming to help balance it out. So, rapid acting and short acting are the two insulins that we worry about meal times. We know that that insulin is going to have a very quick effect, and so we're going to pay attention to when they're going to eat next. With intermediate, remember that's an insulin where they might receive that insulin in the morning, but it's going to take hours before it has an effect, and it's not going to be as sensitive to meal times. And the same with long acting as well. Intermediate acting insulin can be mixed with rapid or short acting. It's really important that you know that intermediate is mixed with rapid or short acting. We don't mix intermediate insulin with long acting forms, only rapid or short acting. With long duration, one of the great benefits is that it has no peak. This is really important. And because of that, there's less risk of hypoglycemia. So when that patient receives long-acting insulin, it begins to work after a couple of hours, but then it never really has a true peak. It just kind of has an onset, kind of stays down here, and then it just has an effect slowly over 12 to 24 hours. So we like this form of insulin because that patient has less risk of hypoglycemia. Whether they skip a meal or not, it's not going to become life-threatening. So we like that kind of insulin. It feels a little bit safer for our patients. And oftentimes our patients like it too because it means less sticks from a needle. Also, with insulin, we give insulin sub-Q. We talked about that. We can also give it IV, but IV we tend to give an emergency. And when we give it IV, it's really important you know this. When we give insulin IV, we're going to give the short acting or the rapid acting forms. We don't give intermediate acting or long acting IV. We're going to give short acting or rapid acting only. And then monitoring for signs of hypoglycemia. So again, our biggest fear when we give insulin is that that blood sugar is going to drop too low, that that patient might experience dangerous hypoglycemia. We said that we like patients' blood sugars to be between 80 to 110. But if it drops below 80, if it's just a little under 80, they're going to be fine. But if it gets lower and lower, so a lot of times patients, if it gets below 60, they might start feeling pretty poorly. So they might feel nauseated, lightheaded, elevated pulse, like weak tachycardic pulse, sweaty diaphoretic, um, weak. Those are all symptoms that our patients might have if their blood sugar drops too low. And so that's what we're monitoring for. That's the worst case scenario. And we know when we might see it most likely is really at the peak. So that's what we're going to pay attention to the most. And then finally, storage. So insulin is a hormone that can be stored at room temperature. At room temperature, it's good for 30 days. If it's stored in the fridge, it's good for 3 months or 90 days. So it's really important when you're caring for a patient receiving insulin that you note the date on the bottle that it was opened, and you know what your hospital or facility policy is about insulin. So if it's been on the counter, it needs to be thrown out after 30 days. If it's been in a refrigerator, it's good for 90 days. Now, I'll tell you what I've noticed: most facilities will use a 30-day policy for insulin because they don't want to have to worry about how long it was out of the fridge or whether it was sat on a counter for too long. So most facilities adopt a 30-day policy for insulin storage. And again, they may, as a policy, want you to store it in the refrigerator, but insulin in and of itself is safe at room temperature for 30 days. So, next, I want to show you just an example of an insulin sliding scale. So if you've ever given insulin before for an elevated blood sugar, especially if you were using a sliding scale and you were checking their blood sugar before meals, you might have used a scale or a chart to determine what their sliding scale dose might be. So here's an example of a sliding scale. Now, on this scale, I know it's tiny, you can't read those little words from here, but you probably can see that it's sectioned out into 3 main sections. We have one section here, one section here, and one section here. So this is actually 3 different scales on one page. Sometimes we have patients on different sliding scales, and it's nice because it does allow us to give patient-centered care when administering insulin. So each of the scales would indicate that the patient would need a higher dose of insulin. So this top scale, let me turn the page here. The top scale here is a low dose scale. In a low dose scale, if a patient had a blood sugar of 151, let's say, so if their blood sugar fell in this range, then the order is to give 2 units of Novolog or Humalog insulin. So again, that's rapid acting insulin, and it's telling you either or depending on the brand that the hospital has. But if you compare that down here to the medium dose, what you'll see is the same blood sugar of 151. Now we actually give 4 units. So this patient would get more than just 2 units. They would get 4 units if they were on the medium dose scale. And then if you compare that to the high dose scale down here, the same number, we're giving 8 units. So this is just an example of how you can have different insulin sliding scales for different patients. If they are very insulin resistant, then they may have a higher dose scale. If they're very sensitive to insulin, they may have a lower dose scale, or they might be in between with a medium dose scale. So let's look at this example. The CNA reports Mr. Laney's finger stick blood sugar is 224. Using the low dose insulin sliding scale, how much insulin will he receive? So let's see, his blood sugar is 224. We're going to go back here. That's going to be right here. And he's going to get 4 units. So back here, this would be the answer. He's going to get 4 units because we're using the low dose scale. Let's check out another common question. So Mr. Laney has just received a carbohydrate to correct a hypoglycemic reaction, but still feels hypoglycemic after 10 minutes. What should the nurse do? So, this is a very common scenario. I like to use this question on tests for my students. And really, it highlights something that we haven't talked about yet, and that is okay, so your patient's blood sugar's too low. Now what? Well, we have a sliding scale. If we go back, it tells us okay, if the patient's blood sugar, let's look up here because I think you can see this pretty well. Okay. So if the patient's blood sugar is less than 61, it gives you some instructions, okay? You can either give half an amp of D50 IV push or 3 glucose tablets or 4 ounces of juice. So, how do you decide as the nurse? Well, a lot goes into making that decision. And it starts with assessing your patient. How are they doing with their blood sugar? Maybe that blood sugar was 58 and they're just fine. In fact, they didn't even realize it was low. Well, in that case, you might choose the intervention that is easiest, fastest for you, maybe preferred by the patient. Probably this over here, just giving him some juice. That would make sense. That would be very appropriate. But let's say the blood sugar's a little bit lower. Let's say it's 48 and the patient is telling you he doesn't feel very good and he's very sweaty, very diaphoretic, his pulse is up and he's saying, I don't feel very well. Maybe you go in to talk to him and his speech is slurred and he's having a hard time communicating with you, and you can tell this blood sugar is low, but also the patient is very symptomatic. So, in that case, especially if you're worried at all that they might choke or have difficulty swallowing, or if their mental status was impaired at all, then you're probably going to give them the IV push. So, those are some of the factors that we weigh when we're trying to decide using a sliding scale or standing orders. When we have the option to choose, we're going to factor in our patient's presentation, how low that blood sugar is, that physical assessment, all of that's going to factor in. So, let's go back to this question here. His blood sugar is low. You've given him a carbohydrate. Maybe you gave him the 4 ounces of juice. And after 10 minutes, he says, I still feel like my blood sugar is low. So what do you do? So this is one of those things that that nurses have kind of adopted a plan here with how to take care of low blood sugar. And that is this thing called the rule of 15s. So it's called the rule of 15. And the idea is that if you intervene with someone's blood sugar, it typically takes about 15 minutes to really see an impact, especially if you're doing it orally. So if we've given juice, after 10 minutes, it's probably true that that patient's blood sugar will continue to climb over the next few minutes. So if you were to check their blood sugar now, then it's whatever it says on that glucometer, it's probably going to go higher over the next few minutes. So in this situation, the best choice, the NCLEX choice, would be to monitor and recheck the blood sugar in 5 minutes. So let me explain this a little bit better. So after 10 minutes, the blood sugar is still coming up. If you notify the provider immediately, then that provider is going to say, okay, it's been 10 minutes. Go ahead and recheck it here in a few minutes and let me know what it is. So we're not going to notify the provider first. We can check the blood sugar, but again, that value that we get is not going to be entirely valid or accurate. It's going to continue to climb. So we're going to want to wait a few minutes. If we chose D to repeat the carbohydrate, well, if we gave him another 4 ounces of juice, that blood sugar would continue to climb. And the goal is not to take it from low to high, it's to take it from low to normal. And so we don't want to repeat the carbohydrate until we know how high that blood sugar is going to get from the first intervention. So the correct answer here is C, monitor that patient for just a few more minutes and recheck the blood sugar in 5 minutes to see what it is. At that point, if it's low, you can repeat the carbohydrate, but if it's high, well, then you haven't given him another carbohydrate and made it worse. So that is the best response. Now, I know what you're thinking. Okay, in real life, would we just go ahead and check the blood sugar? Well, we might, but remember, NCLEX is wanting to see, do you know what the best option is? And so the best NCLEX option here is C. Now, how this plays out in real life, I'm standing with Mr. Laney. I've just given him his juice, and he's saying to me, I don't know, I feel like I'm still a little low. Can I have more juice? And I'm explaining to him, Mr. Laney, thank you so much for telling me how you're feeling. I'm going to wait with you here for just a few more minutes, and then I'm going to check your blood sugar. I want to make sure that it is as accurate as possible so that I know what the next action or intervention should be for you. I want to make sure you get the best care possible. So that's how it might sound and play out in real life. Okay, so now this last question. I want to share this with you because, again, this is a very common test question. This is one that I like to give. I tweak the numbers a little bit, but this is exactly what it looks like on my test. Mr. Laney has received Humalog at 8 a.m. When will the nurse be most concerned about symptoms of hypoglycemia? So this is a very common type of question. And really, the whole point behind it is really assessing, well, number one, do you know what kind of insulin Humalog is? Do you know what kind it is? But also, do you know when a patient would be most likely to have symptoms of hypoglycemia, which in this case is the peak? So, do you know what Humalog is? And do you know when that insulin peaks? So, I wonder if you remember. What type of insulin is Humalog? If you need to, go back to that chart. Let's see. I'm going to take you back there myself. Oop. Here we go. Okay, so what type of insulin is Humalog? Do you see it? Right here. Humalog is a rapid-acting insulin. So, a rapid-acting insulin, we need to know when is he most likely to have symptoms of hypoglycemia. Remember, that is the peak. So, looking at the peak level here, about 1 hour. So, let's see if we can now answer that question. So, if he's received Humalog at 8 a.m., when will the nurse be most concerned about symptoms of hypoglycemia? Because it is a rapid-acting insulin and it peaks in about an hour, the correct answer is B, 9 a.m. Okay, so at 8:30, that insulin is going to begin to work, but it is not at its peak. It's not going to cause the greatest impact to blood sugar until a little bit later. So, and by 11 a.m., it's going to be past its peak, which means the impact of that medication, the concentration of that insulin in the blood is going to be falling, and it's not going to have as profound of an effect. And by 2 o'clock, it's going to be out of his system. So really here, this patient is most at risk for symptoms of hypoglycemia about 1 hour later or 9 a.m. So I hope this lesson has been helpful to you and giving you just a few things to think about with insulin, but also a good summary of, okay, what do I have to take away about insulin to be able to apply to my next test or to NCLEX? So, if you need help with figuring out how to study in nursing school, I want you to download my free ebook. The link to it is just below this video. Download it. I'm going to walk you through how to study in nursing school. It is not something you're born with. It's not that some people are just naturally good and others aren't. It really has to do with strategy. And there are folks that have figured it out that are doing just fine, but there are so many that are struggling. So I wanted to provide a resource for you. I want you to download that. It walks you through exactly how to study. A lot of the examples are from pharmacology because that's the course that I teach, and I know it will be helpful to you. So with that, I want to thank you for watching my video and invite you to subscribe so that you don't miss any other videos that can help you out in nursing school. I'm on Facebook and Instagram as well, and you can always email me if you have questions as well. So with that, I thank you so much, and I hope you have a wonderful time learning pharmacology. Bye-bye.